I'm going to show you the shocking truth about 5 medicines that can double your risk of having a stroke. Just so you know, there are many different types of strokes, not just the ones that cause paralysis or death. There are actually mini strokes that happen all the time that don't really show up on a brain scan. In fact, people who have suffered even one small silent stroke have a 4 times greater risk of having another one. And the problem is that most of these strokes go undetected because they don't cause any symptoms at all. That's why it's important to be aware of the signs and symptoms of a stroke so that you can seek medical attention right away if you think something might be wrong. These signs include sudden weakness, dizziness, difficulty speaking, trouble seeing, loss of balance, severe headache with no known cause, nausea, vomiting, confusion, slurred speech, numbness, and tingling. If you experience any of these symptoms, you should call emergency services immediately. But did you know that certain medications can also increase your risk of stroke? In today's video, I will reveal 5 daily medicines that may be putting you at risk without you even knowing it. Keep watching to find out more. Also, please like and subscribe to support us. Let's get started. Number 1. High blood pressure medications. High blood pressure is a major risk factor for stroke. It makes the arteries hard and stiff and increases the chances of plaque buildup in the arteries. Plaque is a deposit of fat, cholesterol, and other substances that can narrow the arteries and reduce blood flow to the brain, which can lead to a stroke. For this reason, many people with high blood pressure take medications such as diuretics, ACE inhibitors, and calcium channel blockers to help control their blood pressure and reduce their risk of stroke. However, recent studies have shown that some of these blood pressure medications may actually be increasing the risk of stroke rather than reducing it. One study published in the New England Journal of Medicine found that the blood pressure medication valsartan, which is a type of ARB, increased the risk of stroke by 21% in older adults. Another study published in the British Medical Journal found that the diuretic hydrochlorothiazide increased the risk of stroke by 25% in people with a history of cardiovascular disease. While these studies were conducted on specific medications, it's possible that other blood pressure medications may also carry a similar risk. It's important for individuals taking blood pressure medications to work closely with their doctor to monitor their blood pressure and discuss any potential risks. Overall, while blood pressure medications are essential for many individuals, it's important to be aware of the potential risks and benefits of each medication and to work closely with your doctor to develop a safe and effective treatment plan. Number 2. Birth control pills. Most women who take birth control pills do so to prevent unwanted pregnancies. But did you know that they can also increase your risk of stroke? According to a study published in the New England Journal of Medicine, women who use birth control pills have an increased risk of stroke, especially those who smoke. In fact, smokers who take birth control pills have a 4 times higher risk of stroke than non-smokers who do not take the pill. The risk of stroke increases further with age, with women over the age of 35 having a much higher risk than younger women. Although the risk of stroke from taking birth control pills is relatively low, it is still important to be aware of the potential risks. If you are considering taking birth control pills, it is important to weigh the risks and benefits with your doctor, especially if you have any risk factors for stroke, such as diabetes, high blood pressure, or a history of smoking. There are many other forms of contraception available, such as condoms, dental dams, diaphragms, cervical caps, and spermicidal jelly. Using these forms of contraception can help you avoid the increased risk of stroke associated with taking the pill. Additionally, if you decide to take birth control pills, it is important to follow your doctor's instructions and not smoke while taking them. Smoking increases the risk of stroke, regardless of whether or not you are taking birth control pills. Number 3. Cholesterol-lowering drugs. Certain drugs used to lower cholesterol levels, such as statins, have been linked to an increased risk of stroke. A study published in the Annals of Neurology found that statins may increase the risk of stroke in some individuals, particularly those with a history of diabetes. Statins work by blocking the production of cholesterol in the liver, which can lead to a buildup of a substance called coenzyme Q10 in the body. Coenzyme Q10 is an important substance that helps to protect the cells in the body from damage. When there is a buildup of coenzyme Q10 in the body, it can cause muscle weakness, pain, and fatigue. This can lead to a condition called rhabdomyolysis, which can cause the kidneys to stop working properly and can increase the risk of stroke. Other studies have also found that statins may increase the risk of cognitive decline and dementia. These drugs have been linked to an increase in the risk of type 2 diabetes, which is also a risk factor for stroke. It's important to note that the risk of stroke from taking statins is relatively low, and that statins are generally safe for most people when used under the guidance of a healthcare professional. However, individuals who have concerns about the potential risks of statins should talk to their doctor about alternative ways to lower cholesterol levels, such as lifestyle changes or other medications. If you are finding this video interesting and useful, please consider subscribing and supporting us. Your support helps us create more quality content. Thank you. Number 4. Antidepressants. Antidepressants are medications that are commonly prescribed to treat depression, anxiety, and other mental health conditions. Some of these medications, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin and norepinephrine reuptake inhibitors, SNRIs, have been linked to an increased risk of stroke. A study published in the Journal of the American Heart Association found that people taking SSRIs and SNRIs had a higher risk of ischemic stroke, which is a type of stroke caused by a blockage in an artery that supplies blood to the brain. The researchers found that people taking SSRIs and SNRIs had a 31% increased risk of stroke compared to those not taking antidepressants. Another study published in the British Medical Journal found that certain antidepressants, including citalopram and escitalopram, were associated with an increased risk of stroke and other cardiovascular events. The risk was particularly high in women over the age of 65 who were taking citalopram or escitalopram. The exact mechanism by which antidepressants may increase the risk of stroke is not fully understood, but it is thought that they may cause changes in the levels of certain hormones or neurotransmitters in the brain that affect the risk of stroke. However, it's important to note that the overall risk of stroke from taking antidepressants is relatively low, and that the benefits of antidepressants in treating mental health conditions often outweigh the risks. Individuals who are concerned about the potential risks of stroke should talk to their doctor about the risks and benefits of antidepressants and alternative treatment options. Number 5. Sleep apnea medication. Continuous positive airway pressure, CPAP therapy, is a common treatment for sleep apnea, a condition in which a person's breathing is interrupted while they are sleeping. However, recent studies have suggested that CPAP therapy may be associated with an increased risk of stroke. A study published in the Journal of the American College of Cardiology in 2016 found that patients who used CPAP therapy had an increased risk of both ischemic stroke and hemorrhagic stroke. Ischemic stroke occurs when there is a blockage in the blood flow to the brain, while a hemorrhagic stroke occurs when there is bleeding in the brain. The researchers found that the risk of stroke was higher in patients who had been using CPAP therapy for more than 3 years. Another study published in the same journal in 2017 found that the use of CPAP therapy was associated with an increased risk of stroke in patients with end-stage renal disease. End-stage renal disease is a late stage of chronic kidney disease in which the kidneys are no longer able to function properly. The researchers found that the risk of stroke was highest in patients who had been using CPAP therapy for more than 5 years. While the exact mechanism by which CPAP therapy may increase the risk of stroke is not fully understood, one theory is that the positive airway pressure delivered by the CPAP machine may cause an increase in blood pressure, which can put a strain on the blood vessels in the brain and increase the risk of bleeding. Another theory is that the mechanical vibrations produced by the CPAP machine may contribute to the formation of blood clots, which can increase the risk of stroke. Despite these findings, it is important to note that CPAP therapy is still considered to be a safe and effective treatment for sleep apnea, and the benefits of treating sleep apnea, such as reducing the risk of cardiovascular disease and improving quality of life, generally outweigh the risks of stroke. Patients who are concerned about the potential risks of CPAP therapy should talk to their doctor about the benefits and risks of the therapy and alternative treatment options. Thank you for watching our video on the top 5 daily medicines that can double your risk of having a stroke. Please remember to support us by liking and subscribing. Stay healthy and keep taking care of yourself.